Hi everyone, so my name is Dr. Makhdoom Azam, and today this is going to be my first video on this channel, and I'm going to talk about acne. So acne is very something which often comes in the clinic, and we often become very confused with the medicines. So in this video, this is going to be just a brief video, and in this video I will talk about various forms of acne and the medicines which are commonly used in the clinic for the acne. So let's begin this. First of all, I have the most used medicine in the acne. We all know that sulfur, Muxol, Pulsatilla. We know that these medicines are getting so much used in the clinic. But apart from those medicine, apart from sulfur, apart from Eugenia, I'm talking about Calibrome, which is very often used in the clinic. So what is the main features of Calibrome? And I will be talking like the clinical picture of Calibrome with the mental picture and with some physical indication. Okay, so first of all, in Calibrome there is acne on face, which will be like pustules. There will be pus, formation of pus inside the acne, and there will be itching, and it will be worse on chest, shoulders and face. So acne on face with pustules like itching. And the mental condition of Calibrome is that Calibrome is very nervous. It is very we can see that the fidgetity of hands, the nervous hands, not like Zincum metallicum where we see that nervous legs, but here we see the nervous hands, and he is very nervous, very restless, and there is a history of excessive sexual desire or excessive sexual excess, and there is some very peculiar mental condition, like she feels like there is the problem of all the illness is due to divine vengeance of God, due to the wrath of the God. That is a very peculiar theme of Calibrome actually. Calibrome on the physical plane, Calibrome will be very obese person, and Calibrome will be ameliorated when she or he is occupied mentally or physically. So in Calibrome, if a patient come in the clinic with the acne on the face or shoulder or anywhere, but on the acne on the face, and we see that the acne is like pustules, like there is pus, formation of pus, and the patient is obese, and when we dig in the history, we find that there is excessive sexual desire, excessive sexual excess, and there is fidgetity of hands, and he is very restless. Then we can think of Calibrome 200 for acne. The next medicine which is very used in acne is Asterias rubens. So how does Asterias rubens actually feel like? So Asterias rubens is a psychotic medicine, we all know that, and Asterias rubens have red pimples on nose, chin and mouth. And the peculiarity is that Asterias rubens have this kind of symptom when they are adolescent, when they are young. Okay, in the teenager groups we can think of Asterias rubens. So what kind of acne will be there? The acne will be black tipped puncta, small red pieces. Okay, what will be the mind symptom of Asterias rubens? So we all know that Asterias rubens have the contradiction, excites. There will be a lot of anger, there will be a lot of with the contradiction, they will become very angry, and they can weep easily also. What is the aggravation? On the physical plane, there will be aggravation on the menses during, and with coffee, and emulation on the appearance of menses. And I have added some few medicines, very easy and very quick to be used in clinic with the indication. For example, R-Iode. R-Iode can be used in a patient who has been to so many doctors, and he have taken so many medicine, but still his acne is not going, his acne is not resolving. Then we can think of R-Iode, because there is chronic skin affection. Although R-Iode is very much useful in psoriasis, and then there will be marked exfoliation, and when the exfoliation marked exfoliation and leaving raw exuding surface beneath. So that's R-Iode 3x. On the lower potency it will be very good. The next medicine is sulfur iode. So sulfur iode is may be used in acne, but sulfur iode is very much useful in barber's itch. Okay, What is barber's itch? When someone gets a shave, or he feels like itchy on the face after shaving, that's the disease known as barber's itch. Okay. Sanguinary is very much important medicine for acne, but there is abnormal menses. If a female patient comes and we find in the history that there is abnormal menses and she has many form of acne on the face and it is related to the menses, then we can think of sanguinary canadensis. The next medicine is hydrocodile. Hydrocodile have acne due to uterus issue. There may be some uterine problems, there may be some bulky uterus or any kind of uterus problem, and the acne will be present. So hydrocodile, we can think of hydrocodile. Dulcamara. We all know that Dulcamara is very we know the clear picture of Dulcamara, that Dulcamara is affected by dampness, and Dulcamara, there will be acne before menses. In the Dulcamara, there will be acne before menses. Calcarea picrata, when there is calcarea like symptoms, the patient is like calcarea group, and there will be recurrent acne, recurrent boils, and especially on the auditory canal and on the auricular areas, then we can think of calcarea picrata. Okay, calcarea sulf, we know the calcarea sulf is very much useful in acne rosacea, and it is used often on the repeated dose. So there will be yellow pus, we know that. Antimcrude can also be used in the acne, and we know that antimcrude there will be yellow crusted eruption, and it is very much useful in acne rosacea. So antimcrude is often used as in rotation with sulfur 30 and arnica 30 every 3 days for 2 months. Then it can be cured easily. There is some mother tinctures, for example Berberis acufolium mother tincture. It is very often used in acne, and it also helps in clearing the complexion of the female. So in 20 to 25 drops 3 times a day, there will be very fair complexion in the female, and it is very, very useful in acne also. So echinacea is very good medicine when there is problem with the blood, and on that, because of that problem, the female gets or male gets so much of acne problem, pimples, then it can be used. So ichthyolum is also used externally as ointment. So that's all about acne, and we will come later on with the same with the some new disease, some new problems, and the very basic clinical pictures of those problems. Thank you. Stay subscribed.